Hey everybody, this is Gilda Cobb-Hunter. I'm a member of the South Carolina Legislature and I am president of the National Black Caucus of State Legislators. Welcome to the first in a series of webinars on COVID-19 that NBCSL is sponsoring. During the 2 years that I am president of this organization, we have been operating in the first year under the theme Creating Systemic Solutions. I'm sorry, I'm getting excited. It's our first webinar. So creating systemic collaboratives to improve our community's future is the theme of this administration. And we spent the first year building on those collaboratives. You will see a result of some of those of that work in today's webinar. We are, through our policy, NBCSL at the end of the day, determines policy through its policy resolutions. The work that we are doing here with the COVID-19 is frankly under the umbrella of two of our resolutions that have been adopted by NBCSL. One deals and addresses the issue of health equity. The other is an issue that addresses environmental justice. We are working under that framework because we believe and we recognize that this notion of disparity and the disproportionate effect that the COVID-19 virus is having on Black and brown people is simply not news to those of us who have been paying attention. And the point is, what we are hoping will come as a result of the attention on this issue now are some systemic changes that will address the issues that were raised in the health equity resolution as well as the environmental justice resolution. And before I go much further, let me give a shout out and a big thank you to the frontline workers and the frontline folk in the environmental justice community, because they have brought this to our attention. NBCSL in November sponsored an environmental justice forum in South Carolina. We were thrilled to have some of the then candidates for president participate in that forum. What we want to do today is show you the result of the COVID-19 work study group that was created last month. And you will hear from Representative Vivian Flowers after I finish my opening comments. The COVID work group grew out of a conversation that Representative Flowers and I had about this issue and the lack of awareness amongst members of the legislative Black caucuses across the country about what it is, what it looks like, what we should be asking, what we should be sharing with not just our constituents, but with policymakers as well. And so what we have come up with, and I really want to say a special thank you to Representative Flowers. She's the Region 10 chair and has been working, doing a lot of work along this issue. What we hope you will come away with today from this conversation is information that will help you address concerns that your individual caucuses may have, that you as an individual may have, because what we really want to recognize is that when we look at all of these incidents and when we look at the disproportionate impact, particularly in communities of color, we're finding that those states in the southern region are the ones that are really next up. Some are already experiencing some kind of hotspot and whatever. We think it's important that Black legislators in particular be armed with facts and information about this virus, because we are going to be having and involved in conversations where you may feel compelled to choose between restarting or reopening or jump-starting the economy and life of the lives of some of your constituents. And my point is, we have got to be fully informed in NBCSL's view when we start having these conversations. because unfortunately, for a lot of the people we represent, it's a matter of life and death. And we don't think it's too much to ask those of us who are blessed and highly favored enough to be in these positions to make decisions about openings, closures, and all of that with a full set of facts. We have a really great group of panelists here today to share information with you. We're going to start with Representative Vivian Flowers. She's the chair of Region 10 from Arkansas, and I'm just going to go through the names of the panelists. Their bios are on the NBCSL website. And while I reference the website, let me just, and I'll do this periodically, we recognize that we can't hold you to share all of the information that we'd like to share. And a lot of people like me are visual. You hear it, but you really rather see it. And so we've got on the NBCSL website, on our research page, we've got a number of documents that we hope you will refer to. The two resolutions that I mentioned, the one on environmental justice as well as the one on health equity, we want to make sure that you are able to see that, and that is also posted on our website. And so we are going to ask you to make sure that if you've got a cell phone or whatever in the background, if you would put that on mute or vibrate so that if it goes off, I know how legislators are, most of us try to multitask as much as possible. So like me, you probably got your cell phone and your iPad right there next to you. So we're gonna ask you, please, if you would just mute that so that we are able to hear, excuse me, the presentations. And so I'm gonna turn it over to Representative Vivian Flowers, chair of our COVID work group, Representative Flowers, and then we'll introduce the rest of our panelists. Thank you so much. Representative Flowers.
Thank you very much, Madam President. I'm gonna try to keep this brief and cover just a couple of broad points. When I sat down to try to figure out what I was going to talk about, there really is so much to talk about and so much information. As a matter of fact, it's information overload for an overload of problems. I entitled my PowerPoint presentation, Quarantined, Recovering from the Coronavirus While Leading Through My First Pandemic. And I thought it was important to refer to first pandemic because I doubt very seriously that this will be the last time that we have to deal with such a monumental episode in our lives. I don't know of anything else or another time where we've had to deal with such monumental public health issues that spilled over into health disparities, legal issues, our corrections, which we're having a huge problem here, along with a total breakdown nearly of our economy. So I want to talk first about recovering. I was given the call on April 1st that I had the virus. And that was shortly before there was a lot of informational change. I want to focus on just three things. First, my symptoms. I was probably sickest in the 2 days that led up to the day that I found out I had the virus. In my presentation, I'm mentioning that, all of my symptoms weren't consistent, and everything that we've heard in reports, it's about fever, coughing, and shortness of breath. I did not experience shortness of breath. I experienced several other symptoms which are listed on the CDC's Watch for Symptoms list, as well as other symptoms that weren't. And so the thing that I discovered as I talked to more and more people, whether they were my constituents and other folks who knew people who had it, who knew people who died from it, is that really the symptoms run the gamut. And I think that many of us, if we don't know someone who's had it, there's a perception that you can expect to get all three of these symptoms that, is widely shared and published. And then there's a perception that once the symptoms hit, you keep on experiencing those symptoms, and then you just get really, really sick. And I know that most of us have learned and heard that most folks are asymptomatic or have mild symptoms. And even if the symptoms are harsh, you know, then you can, then people are recovering pretty quickly. The thing that is, I think, most important about the symptoms is about the testing, because it is the symptoms that are determining who is priority. And I wasn't supposed to get tested. At the time that I got tested, I didn't have a fever because my fever would spike at night. And then the next morning, because I was drinking water and doing everything that I thought I was supposed to do, if once I knew I was sick, the fever would be gone. And so I had to pick up the phone and call my hospital administrator and explain that, you know, I have body aches, I have a headache, I have a fever, but when I go over there to be tested, you know, when I have the fever, the place is closed. I wasn't even really aware of the hours. So it wasn't until I was challenged with trying to navigate the process and the system was I able to share my experience with other people. And so that testing piece is important, given that, and we all know and have known for a long time, that we have very little in the way of testing, especially compared to countries that have utilized testing to be able to reopen and it be safe. And so there's rationing. And then in terms of my recovery, I'm still recovering. So while I have not had experienced any symptoms since April 3rd, I have had to stay in quarantine and isolation because there's very little information about what really constitutes recovery with regard to whether or not you can pass the virus on to someone else. So I was retested last Monday when there were some, you know, past the 14 days, which is plenty of time. I hadn't had symptoms or a fever since the 3rd, or any symptoms for that matter, except a little bit of a wheeze when I deep breathe. And when I got retested, I still have the virus. And so there is no retesting that is mandated, that is even suggested. I know that the only reason that I was retested was because, number one, I volunteered to donate plasma, but even that hasn't started yet. I was really retested because other members were concerned, I'm sure, and the leadership in the House was concerned I was coming to session and that I might still, you know, be contagious. And so, you know, I'm grateful, but think about all of these people who are going to the sites and trying to get tested with, you know, symptoms, and they're being turned away because their temperature is not high enough. So, you know, in terms of the policies that are set and what we're thinking about, these CDC guidelines, and I have a link so that we can become, if you're not already informed about what that looks like, we need to be aware, because that's at the root of a lot of these issues that we're dealing with. And then in terms of leading, I put that there and I'm using it loosely because, you know, I've been in a room for nearly a month, coming in and out. And so I've really tried to be as dangerous as I can be with a phone and a computer. But I can tell you that aside from dealing with the virus and trying to recover and heal and not infect family members and that kind of thing, wanting to be a resource for my constituents, knowing that they're at home, knowing that they're losing income and jobs and trying to figure out what's going on, and also knowing that there are a lot of people who aren't taking it as seriously as they need to, because we have a curfew in my district, city that I'm in. How do I lead? And so one of the things that I think that is super valuable, that I know is super valuable about NBCSL, is being able to pick up the phone and call people who are going through what we are about to go through, or you know, and who are going through these issues in a real way. I called Senator Kevin Parker, And he just gave me a laundry list of things that he's doing. And so I just wanted to share just a few, and then I'll jump off in terms of how we can best communicate with our constituents. And I have on the PowerPoint about, meeting modes. I don't know about you all. I have never had so many Zoom meetings. I didn't even really know what Zoom was. I think I had used, what is it called? Skype when I was in graduate school over a decade ago. So now I know what it is, and I've also learned about other platforms. And we are also aware of some of the issues in terms of security. So now it's a question of not will I, but what kind, or will, some people, even if they don't use it, they're calling in. But we should definitely make sure that we are using every avenue we can. And then in terms of constituent outreach, most folks don't even know what to ask. They don't even know what to ask. And the people, I don't know what your district is like. A lot of my constituents won't call me because, I don't want to bother you. And so I'm answering calls, but I think that it is time and it's appropriate for us to engage the postal mail and electronic newsletters, and not reserve that just for our campaigns, but also doing regular calls with targeted constituents to provide them information that they don't have, or even just to refer them to the right people. And then in terms of the resources, create your own list or lists of links. You would be surprised that people don't really know where to go. Like right now, we're wanting people to wear masks. It's not mandated in my city and it's not mandated in my state. I just had a pastor call me yesterday who was looking for masks because she was holding a graveside service, and she knew people were going to come and be standing close together and not have them. And so being able to identify a resource for people where they can go buy them, but also where you can grab some for something like that and provide them, as well as contact, the appropriate authorities who can make them available for our funeral homes and for ministers, are some things that we can be doing. And finally, there is an FAQ list that we have been working on and will make available. And I apologize I didn't have it ready today, but it will be customizable for you to use and share with your constituents in a way that is beneficial for folks in your district. So with that, I thank you for the opportunity to address you.
Thank you so much, Madam Chair. And I'm not sure she said it, but Rep. Flowers is from Little Rock, Arkansas.
Pine Bluff.
Oh, I'm sorry, Pine Bluff. My bad.
That's all right.
My bad.
That's all right.
And she raised two issues that I hope by the time this webinar is finished will be more clear to you. The issue of testing and the notion of asymptomatic. And further on in the conversation, we have indeed experts who can talk to that, as well as other issues that we think might be of interest to you. Again, just want to put a plug in for the research section of our website. There will be this. Rep. Flowers mentioned the frequently asked questions. We are working on that. We'll post that so that you can go to the website and use that as a resource. With that, we will now hear from Mr. Michael Griffin, who is the CEO, Daughters of Charity Health in New Orleans. And Dr. Griffin is sharing his time with Dr. Stacy. You know how those Louisiana people are. They just want to make sure they spread it around. So Dr. Griffin, I'm going to turn it over to you, if I may.
Yes, ma'am. And I thank you. First, I want to thank you, Representative Hunter. For allowing us this time to join you. Yes, we're coming to you from New Orleans, Louisiana. I'm the CEO of a community health center, actually the largest one in the state of Louisiana, but really our main service area is New Orleans, and you all are probably familiar with what has happened down here with the major infections we've had from the COVID-19 virus that has affected New Orleans area and the entire state of Louisiana. I am joined by actually Reverend Dr. Stacy Green. He's our infectious disease medical director here at our health center. And we're going to talk a little bit about our, what we think is very important, not just what I would say is in front of us today, because so many things happen in the moment. And as described by Representative Flowers, she was infected. Actually, I just found out today that I was infected and actually had the antiviral test and came back positive. And I'm sure my wife and family, I have 5 kids, have probably been exposed as well. So many of us have been exposed. But the thing we're going to concentrate a little bit more on is those things that we really think are important to work on and continue even after this crisis resides and may flare back up. But work that happens that, as you see, we're so disproportionately affected. The African American community and low income community are being affected. And the thing that matters is a lot of what affects a person's health is not necessarily healthcare. So we're going to talk a little bit about that. But I want Dr. Green to come because I always want to start. First of all, I'm in a family of ministers, even though I'm not one. And Dr. Green is a man of the cross, but also a physician. So I always like to have my Reverend Doctor to kind of kick us off with some facts. And then I'll delve a little bit more into what we're going to call our social determinants of health. So Dr. Green?
All right. Thank you all for having me, and thank you, Representative Cobb Hunter. By the way, I'm from Orangeburg, South Carolina myself.
Your name sounded familiar. Oh, I'm sorry. Go ahead.
And we don't hold that against it. Wait, now I want to ask a quick question. We have some slides. Are we able to pull those up or see those? How does that?
I'll refer to Wayne. Would you respond to that question? Are we posting the slides? Why don't we get an answer to you, Dr. Griffin, and if Dr. Green would proceed, Dr. Stacy, I'm sorry, we will have a response for you.
That's fine. Let me just briefly just give you some brief clinical information about COVID-19, along with some stats from Louisiana. First of all, we all know that the first cases of COVID-19 was identified in Wuhan, China. We also know that this disease is passed on from person to person through respiratory droplets. So an infection can occur when someone's infected droplets have direct contact with the mucous membrane, such as the eyes, the mouth, and the nose. Usually these droplets don't go further than 6 feet, and therefore we have social distancing, not standing within 6 feet of another person. Some data suggest that about 25% of patients with the infection are actually asymptomatic. There's some other data out there that shows that sometimes people can be asymptomatic about 50% of the time. When people do have symptoms, most of the time the symptoms are very mild. So 80% of the time they're mild symptoms, about 14% of the time they're severe symptoms, and then we have 5% of the time where it is very critical. During the critical disease, that's when people start experiencing respiratory failure, shock, and multi-organ dysfunction. As we know from the media, as we know from data, severe illness usually occurs in those with advanced age, along with those who may have some comorbid conditions. COVID-19 is not just a disease that infects the respiratory tract. As we know, sometimes people can develop pneumonia and upper respiratory symptoms, but sometimes it can affect the heart. It can cause myocarditis, which is the inflammation of the heart muscle. Arrhythmias, which is your heart beating out of rhythm. We've been seeing a lot of patients have blood clots and congestive heart failure. We've been seeing exacerbations of kidney disease elevated liver enzymes. And also what we've been finding is patients sometimes may have a decrease in sensation of taste and smell. We've been seeing headaches, seizures, confusion, strokes. But I've also been seeing some patients may not have the classic symptoms of COVID-19, such as the fever, shortness of breath. I've been seeing patients also with some gastrointestinal symptoms, such as diarrhea, abdominal pain, nausea, as well as vomiting. When we look at Louisiana, we know that Louisiana, 32.4% of our population is African American. But when we look at the data on COVID-19 deaths in Louisiana, we see that 56.3% of the deaths were African American, when we only make up about 32.4% of the population. And this information is gathered through the Louisiana Department of Health. We know that African Americans are disproportionately affected when it comes to comorbidities such as hypertension, diabetes, chronic kidney disease, obesity, and cardiac disease. But look at those underlying conditions associated with deaths with COVID-19 in Louisiana. In 56.1% of the cases, those patients had hypertension. About 35% of the patients had diabetes, 20% chronic kidney disease, 20% obesity, 19% cardiac disease. I think the key to handling and eliminating this healthcare disparity, of course, is access, affordability, and health literacy. All of those things are critical, and therefore we're going to turn it over to Dr. Michael Griffin.
So I think that's very important to know where we are with this disease today, but I think it's also very important also to highlight how we got here. And this disease, as we already know, is exacerbated by or really attacks those who have morbidity and already have chronic conditions. I will say, so it's a perfect predator for a community like New Orleans and a state like Louisiana, where the African American community suffers disproportionately from these comorbid issues. Now, why is that? And one of the things that I have been, I guess, on speaking quite a bit about and talking about and really trying to focus on implementation, because Louisiana sits at 49th, sometimes 50th in health rankings of its community, and it's been there a long time. We really have been thinking through and trying to work on improving the health status of our community. And one of the things that we really are digging deep into now are those things that impact your health long term. We didn't get into this overnight, and we won't get out of it overnight. And those things are now being called, I mean, the term for it now is social determinants of health. 80% of what impacts our health is not actual health care itself. So if we go to the next slide, you'll see the social determinants really are those things that are access to health care, as Dr. Green mentioned, a wide array of things that really affect the health of a community. Access, educational attainment. One of the biggest impacts that's been studied is the income level of a person and population. Food, nutrition, transportation, the legal and justice system, all of those things, your environment, all of those things combine to really impact the health of a community. And they impact it by as much as 80%. Only 20% of your health status actually is from the actual health care that you get or the delivery of services that you receive in itself. And so we are really talking to and talking about and working on how do we really shift and get people the resources they need to mitigate the gaps that they have in these social determinants? Increasing, again, access to primary care and prevention, educating on food and nutrition, and helping at this point in time people just to have food on their table, while especially those who aren't working, but even after that, nutritious ways to eat, workforce development and programs that can help improve individuals and their income levels, and be able to have a path to advance in their careers to improve their income levels. Education being another program that should be looked at. So for us, from a state legislative standpoint, you all work in this arena every day. You all work on policies that impact environments, policies that impact education, both early and college and I guess junior college education for individuals. Also, criminal justice systems that we know and access to legal counsel when needed. All of those are things that I would call upstream effects that actually impact the health of our community. As Dr. Green mentioned, 58% of the deaths in Louisiana have actually revealed having hypertension, and hypertension comes from so many things. Of course, our diet, stress level, other just environmental factors that we actually engage with on a daily basis. So all of that actually impacts, again, the social determinants, which actually determine health status. How do we improve that? What do we do? What policies can be put in place today, both at a local, state, and federal level, that moves the needle and actually changes our healthcare trajectory long term? I actually think we should be starting with early education, elementary schools, talking to, and we're doing some of that work here. We have 14 schools that we are providing healthcare and mental health, behavioral health services in those schools here in the local community. But what comes with that also is educating kids on proper habits that they need to obtain over the years to live a healthier lives, dental care and oral health for a longer term and better trajectory. I do think one of the things that we have put in place also, we are employing what we call community health workers, and we are putting those individuals, they work in the community, they work in the schools, they work with our physicians and providers, and they are charged on a daily basis with focusing on these social gaps that these individuals have. They are individuals that come from the community and have social capital with the communities that we serve, and are working very closely with our patients and others who aren't our patients but have gaps and needs. But I do think a long-term strategy needs to be thought through, and especially how we impact those social determinants. Not just look at direct health care that is delivered, but think about what are those things and what are social determinants that actually impact people's health care. Housing is a major issue we found in New Orleans that has had a major gap that we found that has had an impact on the health status of the African American community. And it comes in so many ways and fashions. So all of those actually, if can be addressed, can actually move the needle, not today, but incrementally into the future, and we can actually avoid being disproportionately affected by something like COVID on, down the road. Thank you.
Great. Great. Thank you so much, Dr. Green and Dr. Griffin. And it's a great segue to the rest of the program or the webinar that we have outlined. What we've attempted to do, we started out with Representative Flowers, hopefully showing you the face of COVID. She shared a lot of information about what she went through, asymptomatic and all of that. And of course, from Dr. Griffin and Dr. Green, we wanted to make sure that we had the public health perspective, because in a lot of the conversations around this issue, the public health aspect of it is missing. There are still questions, for example, and I am hoping our next two presenters will be able, for example, to shed some light. There was a reference to testing. For some legislators, there is a lot of confusion around testing because there are so many different types of tests. And of course, the overarching issue around testing is this notion of not enough tests. And for some legislators, the question has become, do we really have an accurate picture of what's happening in our areas? If we don't have a robust testing program, can we really have confidence that the numbers that we are hearing are accurate numbers? And so I would like now to turn to Dr. Niva Lubin-Johnson, who is the immediate past president of the National Medical Association. I talked in the beginning about collaboratives. I was fortunate enough last year to bring greetings and to start the relationship with the National Medical Association. And we are so pleased, Doctor, that you are here to talk to us about infection mitigation and testing. Just in the For What It's Worth department, when I say testing, I'm hoping that you will also shed a little light on contact tracing, because what we found in a lot of states, people don't even think about that. And so I will now turn it over to you to share with us in your own way. Thank you so much for joining us.
Thank you so much for having me this afternoon, Representative Carpenter. And once again, thank you for coming to the NMA annual health policy meeting last year, our colloquium, which unfortunately couldn't be held this year because of this pandemic. But I'm pleased and honored that you asked me to be on this webinar this afternoon. So I will talk for a few minutes about mitigation and testing. I can touch on contact tracing also. For those who don't know, I am from Chicago, Illinois. I'm the 119th president of NMA, as was stated, and I'm a general internist by training. I had a private practice for 29 years, closed it in 2018, but for January, February, and March, when the pandemic was showing itself here in this country, I was actually working in a federally qualified health center and actually performed 3 COVID-19 tests during those last 2 or 3 weeks there. The first one was positive. Fortunately, that patient's illness wasn't severe, but she was ill, but she did not require hospitalization. So first of all, you know, COVID-19, we heard a little bit about what it is from physician colleague from New Orleans, but to be clear for those non-physicians on the call participating, it's a virus. We've got 3 kinds of organisms that cause infection: viruses, bacteria, and parasites. Viruses, other ones are HIV, the common cold from which coronavirus comes from, shingles, chickenpox, measles, etc. Those are viruses. Bacteria, most common one you all probably know is, strep or strep throat. That's a bacteria, streptococcal pneumonia. So that's a bacteria. And then parasites, you may have heard of amoebas, amoebiasis. That's a parasite, and that's the other organism that can cause infection. So where was it found? Where? Well, we know it was found in China, and the presupposition is it came from a bat bit an animal that's kind of like an armadillo this armadillo, the shells are ground up and given to, and is sold to men at a high cost to help with sexual enhancement. And it was ingested, and, you know, and that's how it came about. That's one theory. And it got to the US because somebody from China came to the US. And so the first cases were thought to be diagnosed in New York, but you all may have heard this week that there were 3 cases that were diagnosed in Santa Clara, California, after autopsy, after death, post-mortem. They actually took tissues from those deceased and tested those tissues, and that's how they found out that they were positive for coronavirus. So actually, the governor of California has asked that for any deaths that were of a suspicious nature, I believe starting in December, that where possible, that they be tested for COVID-19. So why mitigation? Well, mitigation is to help really slow the peak of cases that occur. It may not necessarily decrease the cases. It will decrease the cases that are there at that time, but hopefully it's going to slow the progress of cases. And so I am glad that I live in Chicago at this time, where we have taken mitigation very seriously. And we have been under a shelter-in-place order by our governor since March the 20th, I believe, March 21st of this year. It was until next week, April 30th. Yesterday, it was announced that it has been extended until May 30th. I will tell you, I am not surprised one bit whatsoever when it was initially announced, and knowing what we knew at least then when it was announced, I believe that it was going to go until the end of May. And actually, there's one epidemiologist, I believe from University of Washington, that has said that in order for shelter-in-place orders to really be successful, they have to be for 11 weeks. 11 weeks will be June the 6th for Illinois. And so that's pretty close. And so when we say, you know, mitigation, what is mitigation? Well, we saw mitigation come about in phases. And I'll use the example of me going to my large church and how we got to mitigation when this came out. We first got to, during, you know, the passing of the peace, we stopped shaking hands. We bumped elbows. At altar call, we did not hold hands. We locked arms, okay? And so we did that for a couple of weeks. And then once the CDC decreased the number of persons who could gather down to 50, my church went all live stream. And we've been live streamed since, like, I think the Sunday after St. Patrick's Day. And we've had, you know, all live stream for services, including Easter, including participating in different Good Friday services, etc. And so, because now we're at this physical distancing and staying at home. And, you know, the next phase, even before the stay-at-home order, was the closure of schools. You know, and so first schools will close the first week of April, then schools will close till end of April, then schools will close, period. And so, and this is because we see the virus is so contagious that if we didn't go through these steps, that we would have had thousands of people dying every day in the state of Illinois. And so this physical distance, which I prefer to call, really is to help with slowing that peak, creating a plateau, because we want to allow our healthcare system to be able to absorb those cases that come about, especially the severely ill who require hospitalization, ICU beds, or a ventilator. I'll say I became, you know, you knew about this, became more acutely aware when a colleague I found out has been hospitalized for about 3 weeks now to those weeks she has spent on a ventilator. She got extubated last weekend. She was in ICU all those days on a ventilator also. And so it's times like those when you know someone personally, and I appreciate you sharing, Representative Flowers, that, you know, what they're going through in terms of that acute illness. And so we want to make sure, you know, that those services are available for everyone. A lot of states, a lot of areas have gone through adding additional capacity, because even though you're going to plan, what does it say? You want the best, but you want to plan for the worst. And so we've been planning for the worst in that Illinois, the governor chose to open some closed hospitals. One in the south suburbs is under construction, and then created a hospital space in McCormick Place, one of the buildings of McCormick Place, our huge convention center. Over 2,000 beds that are to be used for COVID patients after they've gotten through an acute illness in the hospital, but still are not well enough to go home. Fortunately, we have not had to use all that has been built thus far, and there's even some consideration of not doing construction on a hospital or reopening a hospital in Springfield, Illinois, our capital, because we've done so well at the physical distancing. Actually, our mayor showed a map last week where at a certain point in time, most of Chicago was at 80% of physical distancing and staying at home. About 80% of staying at home. We really think that that's why we've been successful in terms of, we've now moved our peak, which we thought was going to be last week till about now, for about another 2 or 3 weeks. We don't think it's going to be as high as it was going to be, but coming down off that peak may be longer because we're not going to hit that high point that we thought we once were. And so we, you know, really have walked the walk and talked the talk here in Chicago about the social distancing. Why else do we do it? Because when you cough, there was some debate initially if this was a illness that could be transmitted by aerosol. It is. And so we know that the distancing prevents transmission when you cough. And of course, now we know that is no longer a debate, but facial coverings, and we should say facial coverings instead of masks. You don't necessarily need a mask. Are you all still there?
Yep.
Okay, I've lost the screen, so hopefully.
Yeah, it was temporary. Go ahead, Don.
Okay, all right. But facial coverings also help cut down on that dispersion of droplets. And so, and the reason why you cover, it is to cover yourself, to protect someone else from you. We heard earlier about asymptomatic transmission. And so if you don't know you're sick, the person you may be around doesn't know you're sick, and you've got to protect them from you. And so if you wear a mask, you cut down on transmission to them by 80%. If someone else has on a mask too, then you cut down another 80%. And if the two of you are 6 feet apart, then you cut down transmission another 80%. So you've gone with those 3 simple acts, gone from 100% transmission to less than 5% chance of transmission. And so simple things that can be helpful. I just want to add that we need to spread the word in creative ways about the reasons for social distancing. Some of you may have seen the PSAs our mayor has done, Save Lives, Stay Home. And if you haven't, Google them and see them. They're pretty fun. I tell you, and then there have been some memes created. So, one of my favorite ones is, her acting like she's shooting a basketball in her home. And by the way, she was a high school basketball player, but she says, she shoots the ball and says, "Hey, your jump shot was not good anyway. Stay home."
Pretty
So,
good.
yeah. So I would look for those and spread them around, and maybe that'll help someone to be more mindful. And actually about, I will say this, about 40% of African Americans do have it on their mind about, about being concerned about unknowingly spreading the disease. About 30% of us are concerned we're gonna land in the hospital, okay? So we're in the middle of the pack. Hispanics, almost half are concerned about spreading it. 43% are concerned about getting it and being hospitalized. Whites, 28 for getting it and spreading, 18% for being in the hospital. And so there is a need for more awareness about spreading, this illness. Facial coverings, you got to be careful. We've got to send the right message out. Already, I've seen a couple of stories where African-American men have been either put out of a store or even arrested for having on a surgical mask. Not just any old facial covering, not a bandana, but a surgical mask. And so, messages we have to get out to all that this is what's necessary and everybody should do. Here in Illinois, when the governor gets asked, when are we going to reopen the economy? He always says the 3 T's: testing, tracing, and treatment. And treatment, even more so with vaccines, more than quote unquote a true treatment. And, in terms of contact tracing, what is it? It is knowing who someone who's been positive has been in contact with. And I'm sure Representative Flowers had to go through notifying people she had been around to make them aware, because they probably needed to quarantine depending on that level of exposure. And so the tracing gets to be really important as we try to slow the spread of this illness. I just read that before the second round of funds, or third round, I don't know, with PPP was passed yesterday, actually $631 million was released from CDC this week to, I believe, probably county health organizations to handle health contact tracing. And in both South Korea and I believe China, they had some very somewhat elaborate, I won't say very, but somewhat elaborate programs for tracing that involve usage of cell phones. And here Google and Apple have come together to come up with a program for contact tracing also. So hopefully a successful program will come about soon, because really that's what's going to get us to being able to come out of these shelter-in-place orders. Now for testing, we heard from Representative Flowers, what she had to go through with getting tested. And there are 2 kinds of tests. There's the test for when you're acutely ill, and then there's the test to see if you've had an illness, been exposed, and you have developed an immunity to the virus, okay? So the acute testing, we test for a part of that protein particle that we call an antigen, and then for later, that's an antibody. So the antigen testing, although it's been slow coming on board, it is pretty reliable. For Illinois, we, like everyone, of course, the private labs, LabCorp and Quest, where I was working at before, used LabCorp. Like I said, it took 13 days for that test to come back. I think the second and third ones, it got down to 10 days. We heard about Quest having over 160,000 tests, couldn't get tested because they didn't have the staff. So, we've had those kind of things occur with testing, besides just having the tests that were needed to do on people who were ill. And, now state departments of public health also are doing testing. And here that's much faster. My husband actually became ill about 4 weeks ago, just all of a sudden. But he had pneumonia last year. So when he had a cough and a fever, I'm like, we're out of here to the emergency room. And so he did get tested. Fortunately, and went to the state, and it was a little drama getting tested here in that they had to do a form in the emergency room to see if the state would test him. Then did the form, sent it there, had to wait on the answer. The answer was yes. Fortunately, it came back in 24 hours. But until then, we did, we would physically distant, it's just two of us in this house. House isn't the biggest, but there's another bedroom for him to sleep in. There's a bathroom he could use, one I could use. We eat at an island in the kitchen, so we can be 6 feet apart. So we were able to do that for that 24 hours. I was actually given the option of him staying in the hospital, coming home, but I decided to come home because I figured if he was negative, I don't want to be in the hospital and get it from somebody. So that was, part of my decision in that process. Issues with testing also include reliability for the antibody test in particular. And I'll be honest, having the antibody test available at this moment, I don't think is as crucial as having enough of the antigen test so we know who has the disease actively, because right now the antibody test to see if you've had it or you're immune, they really aren't that reliable. I would say at best 50% of what's out there is reliable, and I don't even think it's worth the efforts of trying to find it. I think if we wait a little bit longer, what's reliable, what's not, things are going to settle out about what is and what isn't, and who's better is going to be out there on the market. Just a few words about the inequities, related to what I talked about with mitigation. Some of it was mentioned before, but in particular, housing. If 5 people are in a 1-bedroom apartment, you can't be so physically distant. We African Americans have more of the jobs. We're a higher percentage of those who have a job that you have to go to work. We are essential workers. We are grocery store cashiers or baggers, or we're driving that bus you got to ride to work every day, or we're cleaning, in a hospital. And so that's, making us increase risk for catching this illness also. And then, like I said before, having to ride a bus as opposed to driving to work if you have to go. That's another issue also. So, and the issue with testing gets to be also, like what was said before, this issue of, are we getting tested based on who we are and what color we are, the melanin in our skin. And this gets to implicit, explicit bias, in addition to, cultural competency of those who are suggesting the testing or not. And really, all healthcare systems need to do implicit bias training. And that means knowing, everybody's got a bias. Everybody does. We do, okay? But African Americans, we have less of a bias, but we do. But we still, along with everyone else, should know what our biases are, and then learn how to do better with and treat everyone in a more equitable manner based on the biases that we have. And that's for everyone. And I think more of that's done, then the less of these issues will come about, like this Black man in Detroit, went to 3 different hospitals, had relatives who were ill with the virus and didn't get tested, and he died. Okay, so things like that, should not happen. The last thing I just want to mention is that National Medical Association has collaborated with Rainbow Push Coalition, and has come up with a public health strategy related to COVID-19. And some of the things that I was asked about to talk about, there are actually 12 tenets, but you know, some of those things that I was asked to talk about today are part of those, you know, that strategy, you know, access to testing, access to care, prevention of the illness by mitigation, you know, be it social distancing or wearing a facial covering. You know, all those things are important. You know, remembering our citizens who are incarcerated and making sure that they get the testing and the treatment they need. Right now, Cook County Jail is in Chicago is one of the hotbeds. We've got a state penitentiary. That's another hotbed. I think I heard about one in Louisiana. Mm-hmm. So, you know, we've got to, you know, speak out about those institutions, getting the testing that they need, getting, you know, other staff if needed. Here for our prisons, they have brought in a National Guard to fill in some spots where, you know, they're understaffed because, you know, they got staff out because of this illness. And so we've got to make sure that and speak out that those institutions also, we're looking out for those incarcerated citizens also. So thank you again for the opportunity to be with you this afternoon, and I'll be happy to answer any questions, you know, when we're done.
Okay. Dr. Lubin-Johnson, thanks so much. I tell you, sister, you gave us a lot to chew on, as the old folks say. And I'm glad you mentioned Operation Rainbow Push, because NBCSL has also been working with them in this area. So that's good to know. Would really appreciate it if any of the materials you have, particularly the last one you referenced, if we could get a copy of that. Sure. And for those who may have come on late, on the NBCSL website under research, all of these resources that we're talking about now, as well as the ones that will be developed, will be there. So look for that information at that space.
Yeah, I'll be happy. I'll be happy to share that with you. Also, there's a video I sent earlier that you all can put on your website about you know, dispersion and droplets and why it is important from that aspect also.
And we probably may call you again, because not all of our states are have a governor as enlightened as yours. And I have heard, I've caught his act, and I've heard him talk about testing, tracing, and treatment as the parameter for when things will get back to quote unquote normal. And a lot of us on this call don't live in states where the focus is on testing, tracing, and treatment. The focus is on how do we get people back to work. And so just know how fortunate you are to be in Illinois with that governor and be in Chicago with a progressive mayor like you have.
Thank you.
Go ahead.
No, I was going to say thank you so much. Actually, I'm going to stay on the call, but in Illinois right now, this is must-see TV time, because
I hear you.
At 2:30 in the afternoon is when is his daily update.
Well, honey, well, listen, we will let you stay on and you listen to your governor, because a lot of us listen to America's governor, Andrew Cuomo, so you go right ahead.
Okay, no problem. It's closed caption. I'll still be on the call.
Okay, and I did have a question I'm going to send to you just on this notion of hospital capacity. There are a number of legislators across the country who work closely with the Hospital Association. And in some of our states, the capacity that they were prepared for and the fact that they have not used that capacity is being touted as reason for whatever the numbers are. In other words, we're not at capacity, so we've passed the really bad period, so it's okay to relax standards. Before I go to Dr. Scott, is there anything that you'd like to say about the connection or lack thereof between hospital bed capacity and the rate of this virus?
So, yes, thank you for that question. So actually, what is important is that there are, and this is even said in this president's administration, his guidelines for reopening, that you have 14 days of decreases in new cases, in deaths. I also believe hospitalizations. Also, ventilator usage, ICU usage, etc. And so it's, and no state, none out of the 50 has 14 days of decreases in all those things.
Wow.
So for states to be reopening now, that is almost criminal behavior. Okay. Yeah. So,
all right.
Yeah.
Okay. Thank you so much,
Doc. To understand.
Yeah, and we're gonna be back in touch with you because we've got some other stuff. I'm gonna stop asking questions and turn it over to Dr. Cheryl Scott.
All right, thank you.
Yeah, Dr. Scott, if you would, we are interested in hearing you talk about health inequity. We have heard from our panelists a lot of talk about the determinants, social determinants. We heard from Dr. Green and Dr. Griffin, the role of the community health center. And I would point out, just as a source of pride in what one good thing South Carolina has going on, we have a national model in South Carolina, a community of federally qualified health center, Regenesis, which is in Spartanburg, South Carolina. Our former colleague, Harold Mitchell, is internationally known on this issue of environmental justice and all of the connectors that we talked about. So when we get to the call to action part, Dr. Griffin and Dr. Green, I hope you guys will be able to join us because we want to share with y'all what NBCSL is doing to address all of those non-medical or non-clinical, I should say, issues that are part of this. But I want to recognize Dr. Scott, who's going to talk about health and equity, and would remind the audience, we have on our website a resolution that NBCSL has adopted that deals with health equity, and I want to give a shout out and credit to that to Dr. Ricky Keys, who has been a long time participant in NBCSL, but he's working with us on that resolution as well as we move forward. So Dr. Scott, I'm sorry, I probably took 2 minutes of your time.
No, not at all, not at all. And the 3 speakers before have thoroughly given such a wonderful treatise of all of this, the science as well as the clinical operations, the clinical observations, and just what we need to do. So I'm going to be additive. And Juancina, I think I don't need those few slides that I gave you. I will add them later on. So what I would like to say, I'd like to underscore what Dr. Griffin and Stacy said, just to make sure that people understand that how the virus approaches and gets into our Black communities more easily has to do nothing with biomedical aspects. That's really important because when you hear people talk about that, that COVID is in the Black community, it sounds like we came out of the womb with diabetes, hypertension, asthma, et cetera, and it's really important that the social determinants and all these other conditions be understood as having an important role in influencing this. So I'd like to mention some more of these, the chronic diabetes, the hypertension, the asthma, mental health conditions, chronic as well. That really, particularly now, that really also makes one more at risk of getting this virus and not following the protective behaviors. The precarious essential service job that Dr. Lubin-Johnson mentioned. That is, it's almost like you're walking into a battlefield with the virus. That really puts you at incredibly excess risk. The exposure and the lack and the absence of income, adequate income, lack and access to adequate education, lack and absence of chronic, lack and absence of wealth. This is a very important aspect. These conditions, they've been with us for a very long time. They've been with us over generations, and we have not been able to make a move. Some of the economists feel is because for generations upon generations upon generations, we have not had any wealth, any reserve that we were able to pass on to our next generations. So when COVID hits and you're not working, if you have wealth, you say, okay, we will use the wealth right now, versus having our family member go and drive the bus. We don't have that. We don't have that in our communities generally. So I think it's really important that we understand that when you're talking about correcting health inequity, you really are talking about addressing issues that have been there for a very long time and are very hard to address. But there are some things that the legislators can do. There are a lot of resources on the web, and we're all now on the web. So it's really important that you can look by program area. You can look for diabetes. You can, of course, look at CDC, but there's others. There's diabetic associations. There's the International Society for Hypertension in Blacks. There's a lot of resources, and just go to those sites. Go to those sites and see what information they would have for you. Also, you can get grants from CDC as well as some of these associations, particularly for programs that you want to implement. So you do have to have someone searching that. If you can have someone in your office just searching that, the research is really important. Another thing that I would say is critically important to do is have someone in your office doing the research on a regular basis. What is happening now, it's not just in peer-reviewed journals. I mean, yesterday, Dr. Lubin-Johnson and I were talking about all the things that we were seeing that was kind of like, stunning us, surprising us. And some of it is in journals, but most of it is in the newspaper. Most of it is in, the news media. And it's really important that someone keep abreast of this and keep abreast of what is coming down the pike. And it's really important if you can, legislators in your office, if you have someone that you can dedicate to making sure that on a daily basis that is observed. Because a lot of this is not, the journals are lagging behind. The science is lagging behind. Another thing you can do is, besides the testing and the all of the, I agree with Dr. Lubin-Johnson about the antibody test, but we really do need to have the RNA test, the virus test right now. But the antibody test, people are trying to get, and I don't quite understand why, because what the antibody test is going to tell you is possibly you've been exposed. They don't know for how long that immunity lasts. They don't know if it lasts 6 weeks. They don't know if it lasts 6 months. And right now, the science is just not there. It is not reliable. So I think it's really important to make sure that as legislators, that you, in your communities, that people get tested. It's like we're doing such spotty testing in this country. An example of another type of way to do it, another method, it's a smaller country, but in Iceland, they tested everyone, much smaller. However, what they found was such a large proportion of people who were asymptomatic carriers. They were those who were positive and they were asymptomatic. And what they did is they said, well, you all come stay over here. And within just a little bit of time, a large proportion of those patients became symptomatic. So it really validated for them that we need to quarantine those who are positive. So it's really important that testing be available, because right now it's hard, as we've heard, it's hard to get testing. my husband is in Oakland. I'm from Oakland, and he went to Stanford to get a test. They offered him the antibody test, so he got the antibody test. And I said to him, "What's that going to tell you?" And he actually was negative on it. And I said, "Do you feel confident that you've not been exposed then?" And he agreed that right now we just don't know the status of that. So just make sure that you have testing available for those in the community who want them. And affordable care. In many places here, particularly in the South, Medicaid non-expansion exists. Got to figure out a way that people will not have to go to 3 hospitals before they get care. There needs to be, if you hear of that as legislators, I think that it's so important that you be on that and help people so that that doesn't happen. I mean, we are already witnessing a dramatic loss of life. Dramatic. I saw just a moment ago, we've reached now over 50,000 dead in the United States. And we already know that our communities represent a disproportionate number in those deaths. So it's really just incredibly important that people get tested. So I wanted to share that watching the data is really important. And we've had quite a clumsy spill out of data. I think the states have done a good job of sharing the data. And I was with CDC for 20 years, and I was there when there was incredible leadership. David Satcher, Bill Foege, even Mason. It didn't matter when if the administration was a challenging administration. The leadership at CDC is really what made you want to give the best quality to your work and make sure that you are complete. And that includes capturing and reporting race. So it's really, things happen cyclically at CDC. And I think that it will come back to a time where there will be that attention to the kind of detail that is really going to help states and help our country. The very last thing I would say about that, and those few CDC directors that I mentioned, there is an aspect of them that I think as legislators, you need to make sure to just make sure that you are somehow thinking about this aspect for your communities. And I'm going to end with a quote that I heard on another webinar. I've been going to so many webinars. And I remember this quote and I thought it's so apropos. And it was it was written in 1899, even though it could have been written, last week. The most difficult social problem in the matter of Negro health is the peculiar attitude of the nation to the well-being, about the well-being of the race. There have been few other cases in the history of civilized peoples where human suffering has been viewed with such peculiar indifference. So that was Du Bois, and that was in 1899. And that's a stain. So as we talk about all the chronic conditions, it is so important to recognize chronic racism, the chronic racism that is afflicting our communities and afflicting our daily lives, afflicting our maternal and child health outcomes. This is a part of it. And, a lot of times it is structural, institutionalized. It's really important to recognize that and don't feel that, okay, well, I don't want to have this piece there also. I agree. We need implicit bias training. We need anti-racism training. We need a lot of these trainings, but we need to go even further than that. But one of the things we need is to have empathy. And we're in an empathy gap. And what Du Bois pointed out is that there's no empathy, and empathy is what will drive political will. So it's really important to have our communities rise up. We need to get that political will, and we need to find people that will input that kind of empathy, the way I said that the leadership of CDC was in the past, and I'm sure that it will be in the future. So I'm going to stop right there in case we have any questions or anything. Thank you very much.
Wow. Oh man, I mean, all of y'all, I'm speechless. As one person said, sister, you just dropped the mic on what you just said, okay? That is, I do want, and I know we're running short of time. My goodness, one of the lessons from this is we're gonna have to do more than an hour and a half, or the original moderator who's only observing. I was not supposed to be doing this. I was supposed to be laying back at the cut as well. Maybe when we have that certain person who was supposed to moderate, he'll do a better job because he won't talk as much as I do. But I have to ask you a question for clarification.
Sure.
And that was a point you made about the testing. You were talking about the testing that your husband did, and you said the antibody test was, I just want to make sure that, because we aren't clear, some of us, about testing, and I want to make sure that the antibody testing being negative, just the difference between that and the COVID, if you could.
Dr. Lubin-Johnson also referred to this. So the science for these tests are evolving in real time. It's evolving right now. So if you get an infection and you develop antibodies to it, if you get chickenpox, you can go and see that you've had chickenpox and you have antibodies to it. That one may last a lifetime. But right now, we don't know what it means when you have antibodies. What does that mean is what the scientists are saying. They really aren't sure how long it lasts. So, you may have some confidence of, oh, I've been infected and I've got immunity now because I have antibodies. They don't know how long those antibodies are going to last. They're not even reliably sure that the antibodies are there. So the test that you want to get is the test for the virus. The virus gets in you and you make antibodies. So you make your own body produces antibodies to the virus. So you want to make sure that you see that the virus is in you and that you have an acute infection. Or if you have no symptoms, you need to wait because it is likely that you will develop symptoms and you don't want to infect other people, so you want to quarantine yourself.
Thank you, Dr. Scott. And we're going to ask, and our staff will be reaching back out to you because we want to make sure on that resource, on the research section of our website, that we have specific information about the test and the various kind. And as we wrap this up, I am going to turn it over back to the chairwoman of this work group, Representative Flowers, who will bring you up to date on some things that NBCSL has been working on. Madam Chair.
Thank you, Madam President. I have learned so much. I was over here chatting when you called me back to the mic. I just wanted to point out a few things, that a lot of the information that has been provided today, and I think in case you didn't see it in the chat, that it will be made available on the resource page of the NBCSL website. And also, if you haven't had a chance to check out that website and see the information that it's available to you, I want to recommend that all of the attendees, panelists, everybody, take a look at it. I think that the staff has done an awesome job in providing data. I'll also say though, and I'm going to go back to what I started with and what Madam President mentioned, what we're doing now really grew out of a conversation around the need. And we talked about the infrastructure that we have through this organization. And if we don't use it, shame on us. We have regional chairs, we have state chairs, we have a staff, and we have an executive committee. And so as we've talked about what the needs are in terms of how do we operationalize our organization outside of what we normally do during this pandemic, it just made sense to figure out how we use that infrastructure to disseminate information, to bring together partnerships, to share information like what we're doing today, and do so in a way that acknowledges and understands that we all have different levels of literacy as it relates to technology. And we all have different districts. We all have different states. And so trying to create a template for anything is challenging, but it's necessary. And so I'll just close by saying that what we are working on is a way in which we can partner with the governors across the country and share a lot of the information we've heard today in a way that establishes some recommendations about how to deal with the health disparities during this pandemic. And I think that, you know, for me, I don't listen to a whole lot of the national updates until it's time to listen to Dr. Fauci. And however, you know, I did hear him speak on the death rate of African Americans and people of color, and hear him refer to the health disparities as something that has been a long-standing issue and something that needs to be addressed, but almost refer to it as something that can't necessarily be addressed now. And I think that that is
right.
absolutely not correct.
Yes. Yeah.
And if we don't define what that looks like as an organization, as NBCSL, as our state caucuses, as our regional groups, then it's not going to get done. We are ground zero, and we also are up here in terms of the big picture as well. And so I think if we use that leadership through effective communication, not only with our districts, but also with each other, and then with our partners, and then in our states with state leadership, it doesn't matter what our seat at the table is. It doesn't matter about partnership. When we're using our collective voice to use our state group caucus voices and our individual voices, I think that we can serve powerfully for our constituents and our families and our communities. And so I think that means, number one, defining what our recommendations are, establishing that partnership with the NGA, alongside our partners like the NMA, the National Bar Association, the Black nurses. You know, we've kind of developed a list of organizations that are already our partners, and that we can forge new partnerships with as well. And then once we have established that or completed that, then how do we disseminate that to our own governors, to our own communities, to our own local leaders? And then finally, defining a communication structure so that we all have the same talking points. Now, obviously, depending on where you are, you might need to tweak and reframe exactly what that looks like when you're talking, depending on who you're talking to. But having that communication framework, leaning into our infrastructure and working with our partners, establishing new partnerships, and having a really strong message about what we need to be doing as a nation as it relates to these disparities, and not only as it relates to the death rate, but also the infection rate. And then we've heard a lot about how health is affected and affects so many other dimensions of our lives. And so there's going to be a time when we, you know, they're talking about opening up. So recovery, economic recovery, that same conversation, that same infrastructure, that same effort needs to be continued when we have those conversations. And then when this comes back around in the fall, as we're hearing about the possibility of reinfection and another wave of this pandemic. Thank you.
All right, I hope y'all can see by those comments that you just heard, by the comments you just heard, why Representative Flowers is chairing this work group. Phenomenal job, Rep. Flowers. Thank you so much. I have the task now of bringing this to a close. Those of you who know me know I am almost obsessive compulsive about time, starting on time and ending on time. But I'm going to take the privilege of the chair and give myself 2 minutes to close this up by piggybacking on the segue that Representative Flowers just offered. Please know that this is the first of a series of webinars that we're going to be doing on this issue. She talked about recovery. We are working on the economic aspect, and I'm so thrilled that we're going to have, for example, our chair of our business committee, Senator James Sanders from New York, who is doing a phenomenal job up there. But I'm saying that to say, hopefully you will complete the survey that will pop up as you exit the screen. Please feel free to be constructive and honest, because we want to improve. This is our first effort, and we would really appreciate your taking a couple of minutes to respond to that survey. In closing, let me say that we've heard a lot of information here. Doctor referred to cultural competence, implicit and explicit bias. And this is an opportunity to tout the work that NBCSL has done over the years. A lot of my colleagues who are on the line, for example, will recognize that we have years ago passed a resolution calling for cultural competency in the healthcare and medical field, calling for doctors for that to be a part of the curriculum in medical schools. And so there are a number of things that we've talked about here today that I just want to give a shout out to my colleagues who have been involved and engaged in NBCSL. For those of you who this may be the very first encounter you have had with NBCSL and you may have thought about getting active, hopefully this will encourage you to really be engaged. We are the national voice for Black legislators across the country and in the territories. Rep. Flowers mentioned a letter to the National Governors Association. NBCSL is a nonpartisan organization. We have Republican and Democratic members, had one independent at one time. But my point in saying that is because regardless of what state you're in and regardless of the leadership at the top, these issues remain the same. And as she pointed out, the information we're going to provide to you is a template that we hope you will tweak. But the final comment is what we challenge each of you on this call to do is to commit to increasing your awareness about this issue. Don't just accept numbers without questions. Understand that people have an agenda. Be clear about who you represent, those voices that are not at the table. And just as an example, when we talk and have these conversations about reopening the economy, understand that there is not one Black caucus member in any caucus, in any legislature across this country who doesn't feel the impact of this economy being shut down and who don't want to get things back to normal and get people back to work. But there are a lot of us out there who believe that it is equally or more important that as we balance the economy and revving and reviving the economy with the cost of lives that may come with that, we at least be cognizant of that. Because when we talk about opening things up, remember a part of why this virus has so disproportionately affected Black and brown people is because we're the ones out there doing the work. Okay, and so you've got to just connect the dots and understand, for example, when all schools are closed and you've got that parent who has to go to work, there are issues of childcare. Who's going to keep the kids? You know, we've moved from the day when grandmama used to be able to keep the kids. There are just so many factors involved. But my final comment to you would be that NBCSL has always been and will always be committed to being the voice for Black legislators across the country. And I just hope that y'all will take a moment to fill this out. Go on our website and look at some of these resolutions that we've done through the years. Because what you will find is that we have been very actively working on a lot of the things that y'all have talked about. So thanks so much for joining us. Fill out the survey, go to our website, and let me, because golly, that would be a big oversight. Let me give a big shout out to the NBCSL staff and consultants who were engaged in this. Our executive director, Ms. Wanzina Johnson, our IT guru, Mr. Wayne T. Roach, our deputy director, Joe Grant, our lead policy associate, Fabian Antone, and we want to welcome, of course, and the Honorable used to be Tanya Cook, who is one of our consultants, and our newest one, Mr. Lamar Davis, who was the deputy chief of staff for the governor of Arkansas, Governor Beebe. And I know he has really felt like he has known me for years instead of only a couple of months. So, hey, so thanks y'all. We were only 6 minutes over, but that's because of me running my mouth. To our panelists, we're going to be back in touch. Dr. Lubin-Johnson, Dr. Scott, and Dr. Green, and Dr. Griffin, y'all were the bomb. Y'all rocked. Thanks so much for sharing this information with us. Y'all stay home, stay safe, and don't be afraid to say to your colleagues, you know what, you just go right ahead on. But as for me and my house, I'm staying home. Take care, people. Bye.
Right. Thank you. You too. Thanks again. Nice meeting everyone.
Likewise. Your governor off, Dr. Johnson?
What's that?
Your governor is done?
He's still on. No, he's questions and answers. And actually, let me share with you all the numbers today. We had 2,700 new cases. That's the most in a day.
Oh God!
I do, but it is because we had 16,000 tests. That's our. So we're almost twice what his goal is in terms of.
Wow.
So that was a high.
Amazing.
Yeah. So we're almost 40,000 cases and about 100.
Wow.
Mm-hmm.
So we need to be pushing testing, right? Forget what they say we are.
There are over 50 testing sites in what I'll call the Chicagoland area, Chicago and the surrounding counties, in addition to, you know, other cities across the state of Illinois. And I'll share this with you lastly. Not only do we have, you know, the governor who's doing the right thing, but our director of Department of Public Health is a sister.
All right.
Yes.
Is a sister who, wait a minute, look, S on her chest, married, 4 kids.
Wow.
Husband's a doc also. And
wow.
Her oldest child, she also has to deal with being a senior in high school and missing graduation.
Oh.
Yeah. So
wow.
she's been rocking. She's
wow.
She's been with him every day. He gave her Easter off, but she every day to do the medical report.
Well, tell us, sisters, right? You know, Black women, you want a job done, give it to a Black woman.
That's where you go.
All right, guys. So y'all be safe. Thanks
all right,
so
thank
much.
you.
Enjoy.
You too.
Bye-bye.
All right.
Bye-bye, everybody.
All right, you're welcome. Bye-bye.
Thank you. Bye-bye.